Hey gang, this is going to be a review. I've downloaded a new app called Explain Everything, and I'm hoping to use this to help highlight some of the key concepts we discussed in these last few weeks that will be on your second midterm. I've received a number of emails from students, and so rather than just emailing them back, I'm going to use this app to explain some of the key concepts and hopefully review some of this information that you should know and understand and find relatively easy. However, if you were absent from class or are struggling with a concept, maybe this will be a way to explain it and review it. The first key concept that I want to introduce you to is peak and trough. And again, most medications don't require a peak and a trough. However, medications like aminoglycosides, which are your dangerous antibiotics, will require a peak and trough. These are extremely dangerous medications, and we want to keep them in their therapeutic range. So as you have a patient presenting with signs and symptoms of infection, you're going to want to swab them, and then you're going to want to start antibiotics. If it's a severe infection, we're going to revert to our aminoglycosides. These are the medications that usually end with mycin or mycin, and they're very powerful, very potent. And I think we talked about in class how these could be very dangerous to two vital organs. Hopefully you know which vital organs the mycins are, or the aminoglycosides are dangerous to. I'm hoping you said kidneys, and I'm also hoping you said ears. Again, these medications are considered nephrotoxic, so it's hard on the kidneys, or ototoxic, hard on the ears. This would be your blood level, and we want it in the therapeutic range. And I'm going to draw a T and also a T. So we want it somewhere in between the top number and the bottom number. So you're going to want to administer your first dose of antibiotic immediately after you get your swab, so we can begin treating the patient and hopefully eliminating their signs and symptoms of infection. And when you give this medication, these are very powerful big gun medications. It's going to go into the bloodstream and come up and then peak down. We usually give these medications once in a 24-hour period because they are so potent and powerful. And so the next day, before you give your second dose of antibiotic, you're going to want to draw some labs right here about 30 minutes prior to the next dose of medication. You're going to want to do a trough level. So you're going to want to collect some blood, send it off to the lab. Then you're going to want to administer your medication, and about 30 to 60 minutes after that one, you're going to want to get a peak lab work. So you're going to get a peak level or blood work and send that off to the lab. And again, all the while we're trying to make sure that it stays within your therapeutic range. We never want it to be up here. That would be considered what? Hopefully you said toxic. Up here would be considered toxic, and down here would be considered what? Hopefully you said subtherapeutic. So that explains peak and trough. It's usually referred to or used with medications like aminoglycosides. Okay, so this medication we're going to talk about is penicillin. Maybe some of you have already taken penicillin, I'm not sure. Commonly we used to use this a lot. It was considered a very strong, powerful antibiotic, and we're going to talk about penicillin G. Typically your patients will be complaining of signs and symptoms of infection. These are serious infections such as pneumonias, respiratory infections, rheumatic heart disease, gangrene, septicemia, which is just bacteria in the blood, also meningitis, and also syphilis. We do use penicillin for syphilis. Again, it is an antibiotic, and so we know that it won't affect any vital signs. It shouldn't affect any vital signs. However, in terms of lab work, whenever you have an infection, you're probably going to have increased white blood cells. So if you have increased white blood cells, we're going to monitor for a reduction in those with the improvement of the infection or with additional medication. Things that you want to teach your patient regardless of whatever antibiotic that they're on health teaching would be that you want to take this medication until you're completely done. So the complete course of therapy, and you don't want to double up on your doses. That will not kill the bacteria any faster. In fact, it may be damaging to things like your kidneys. So very important, don't double up to kill the bacteria. Don't stop this therapy, take it till it's completely done. However, they do need to know when to stop this medication if they see signs and symptoms of diarrhea or hypersensitivity like hives or a rash. Then those things warrant our patients understanding that they need to stop this medication. If they don't stop this medication, they could wind up in a lot of trouble. So if they are having hives or some kind of reaction like a rash, then you could probably reach for Benadryl or anticipate that the doctor will order Benadryl. That being said, if they're having an anaphylactic reaction, again life-threatening, then they're probably going to be giving something like epinephrine to help maintain life, because anaphylaxis is life-threatening. And again, important principle that if you've taken the pill once, if you are allergic, your reaction may be minor, and then with subsequent exposure to the medication, your reaction could be twice as strong, and with third or fourth, it could be really strong, in fact, life-threatening. So you really want to make sure that you don't ever take this medication again. So we advise people to wear a bracelet if they are allergic and have had anaphylaxis. Also with penicillin, if you're allergic to penicillin, we also want to teach them never to take what medication, or quite often certain patients will be cross-sensitive. If they're allergic to penicillin, they will be cross-sensitive to, hopefully you said, cephalosporins. All right, so that's another medication that we consider holding or not giving, especially if their reaction was anaphylaxis. All right, key thing that if you're giving the very first dose of this medication, you want to be on the lookout for those signs and symptoms of hypersensitivity. And again, that's the rash and the hives, or increasing heart rate, blood pressure, temperature. So if those start to elevate after you've exposed them to this new medication, then you want to stop it, call the doctor immediately, and you'll be asking for something like Benadryl. And you'll be also doing vital signs. You're going to monitor them significantly. Okay, our Cipro. So that's another medication we'll commonly see given. Ciprofloxacin would be another name for it. And this is usually used for urinary, respiratory, bone, or gut infections. Could also be used for eye infections, ear infections. And we teach patients to be on the lookout. Again, what health teaching do we do with every antibiotic regardless? Well, we teach them, again, to take the full course of therapy and don't stop unless they experience what? Yes, diarrhea. Whoops, that's my horrible writing, gang. Or signs and symptoms of hypersensitivity. So we watch that. And we teach them to take it as prescribed, and so never double up. So don't be doubling up on this medication. So don't miss a dose, take the full therapy, and only if you notice that you're having diarrhea or a rash or some kind of sensitivity do you stop it and see your healthcare physician. The other thing that we want to teach them is we don't want them to take it with any kind of iron supplement, and we want it, there could be some reactions with milk, so we tell them not to take any dairy or iron supplements around this medication. Again, Cipro is an antibiotic, so it should not affect your vital signs, so there should be no vital signs that you need to know prior to giving it. And it will not really affect any significant lab values, but you keep an eye out for your kidney functions. And again, what tests are those? Hopefully you said right. That's your kidney check engine lights. And again, with any kind of infection, you want to monitor for an improvement in symptoms, so we'll hopefully see a decrease in white blood cells back to normal. That's our goal. All right. Okay, the next medication we're going to talk about is Tetracycline. This is another common medication that we'll often prescribe. It is a broad spectrum antibiotic, and we'll give that when we're not sure what the organism is. We'll give it for both gram-positive and gram-negative. Again, the health teaching that you would want to do with antibiotics, you'd want to complete the full dose of the antibiotic. You don't want to double up on your dosing. And the only time you wouldn't complete the full dose is if they're having any signs of an allergy, like a hives or rash, or if they're having loose stools. Okay. Whoops, loose stools. Also, we said, I'm going to shrink this and move this over here, you don't want to give tetracyclines to anyone who are pregnant, anyone who is lactating, or anyone less than 8 years old. So if they're less than 8 years old, we know that it could be harmful to the teeth. We know this medication is harmful to the bones. And so we don't give it to anyone who's less than 8, pregnant or lactating. We watch out for that yellowing stain of the teeth. And if they've already got bone marrow damage or suppression, we keep an eye on our white blood cells there. All right. Also, we want to teach them to be very careful in the sun, so they need to wear some kind of sunscreen or some kind of sun protection. Also, this may impact or impair their birth control, so we want to teach them to use some other form of birth control other than oral contraception, some other barrier mechanism. And again, when you're giving any kind of broad spectrum antibiotic, you really want to watch out for supra infections. Supra infections. So those would look like yeast or some kind of fungal infection. And if patients are allergic to penicillin, we sometimes see a cross-sensitivity with that. So be very careful with that. If this is their first dose, you want to monitor them for any kinds of hives, again. Or if you also want to keep an eye out for any kind of increased heart rate or blood pressure or other symptoms that might indicate that they're having some kind of reaction. The next medication that I'm going to talk to you about is Flagyl, or metronidazole. Again, it ends with diazole, so whenever you see a medication ending with azole, you know it's an antifungal. It's also an antibacterial. Same health teaching applies. You want to teach them to take the full course and be out on the lookout for any kind of supra infections. Here. The other thing that you want to teach patients that are on this Flagyl is that alcohol is something that is contraindicated with Flagyl. So you never mix alcohol with Flagyl. Or if they've got liver impairment, it is also hard on the liver. So you're going to do your check engine lights for your liver. Hopefully you know what those are by now. Those are your AST, ALT, and also your alk phos. A side effect that may occur that is harmless is they may have some harmless darkening of their urine, and that's normal. That's nothing to be concerned about, but it is something to tell them to monitor for. All right. All right, hopefully this wraps up our key concepts for antibiotics and antifungals. If you have any questions, please post them on discussion board. You can post a question anonymously, and hopefully a peer will also answer or offer up an answer. If you've got a question, please shoot me an email at dmears@stclaircollege.ca. Take care and stay tuned. There'll be a cardiac key concept video being uploaded shortly tomorrow. Bye.